In this video, we will discuss the pathological features of hypertensive heart disease. Firstly, we will discuss the pathological effects of systemic hypertension on heart, including the concept of left ventricular hypertrophy, which is very important concept from clinical point of view as well as examination point of view. And then we will study the effects of pulmonary hypertension on heart. So let's start. So whenever there is systemic hypertension that is present for a chronic period of time and remains untreated, the walls of left ventricle becomes progressively thicker to pump the blood against high resistance. This thickness of walls of left ventricle is called left ventricular hypertrophy. Now this thickness of walls in hypertension has a specific pattern which you all need to understand carefully. So you can see here in this diagram that this is left ventricle and this is right ventricle, and you can see that walls of left ventricle are thickened in form of concentric inner circles, and this thickening happens towards the inner side, reducing the size of cavity as well. Such a pattern of hypertrophy that occurs in form of concentric inner circles is called concentric hypertrophy. And in concentric hypertrophy, not only the walls of left ventricle are thickened, but you can see that there is a resultant decrease in cavity size of left ventricle. Now the problem with left ventricular hypertrophy is that when it progresses to more and more severe level, the gradual reduction in size of cavity of left ventricle reduces the amount of blood that can be stored in left ventricle during diastole, which results in diastolic heart failure. Diastolic heart failure means that heart receives only a small amount of blood during diastole due to its reduced cavity, and as heart can only receive a small amount of blood during diastole, so resultantly during systole it can eject only a small amount of blood. So this reduction in level of blood that can be ejected by left ventricle results in heart failure. Now here at this point it is important to compare this with the exercise induced hypertrophy that occurs in athletes, which is obviously a better type of hypertrophy. And in such cases of continuous and heavy exercise, the increase in thickness of walls of left ventricle occur towards outer sides and does not reduce the size of cavity of left ventricle. Such pattern of hypertrophy will be called as eccentric hypertrophy, and as the size of left ventricle is not reduced in eccentric hypertrophy or exercise induced hypertrophy, so it will not cause heart failure. Now on microscopic view of hypertensive heart disease affected by systemic hypertension, you will see myocytes hypertrophy characterized by increase in size of cardiac myocytes and enlarged hyperchromatic nuclei. Such enlarged hyperchromatic nuclei are known as boxcar nuclei. So you see increase in size of cardiac myocytes with enlarged nuclei. Now we will study the effects of pulmonary hypertension on heart. And first of all, you need to understand the concept that pulmonary circulation is connected to right ventricle of the heart. Now as the walls of right ventricle are not as much thick as that of left ventricle, so right ventricle is more vulnerable to develop heart failure as compared to left ventricle, which is why the systemic hypertension leads to heart failure only after a long period of time, but pulmonary hypertension can lead to heart failure very early in the course of disease. Now we will study the effects of pulmonary hypertension based on whether it develops acutely or chronically. If there is acute development of pulmonary hypertension, then right ventricle will not be able to pump the blood out of it, so right ventricle will be dilated with the stored amount of blood that can be not pushed out. So right ventricle becomes dilated, and this acute failure of right side of heart is called acute cor pulmonale. Now if the development of pulmonary hypertension is chronic in onset, then right ventricle will have times to undergo thickness of its walls, that is called right ventricular hypertrophy. So in chronic cases of pulmonary hypertension, you can see right ventricular hypertrophy. And as increased pressure in pulmonary circulation will cause atherosclerosis in pulmonary arteries, so on gross specimen you will also see atheromas in pulmonary artery. So overall in chronic cor pulmonale, which is heart failure caused by pulmonary hypertension, you can see right ventricular hypertrophy and atheromas in pulmonary artery. And again it needs to be mentioned that the type of ventricular hypertrophy in cases of pulmonary hypertension will also be concentric in the form of inner circles with reduced size of cavity, which is similar to what we see in systemic hypertension. This concludes our discussion of hypertensive heart disease.